A lot of things are unknown for patients who are looking for having implants. How long, for example, it's going to take, the process itself. A lot of people are scared of having pain, for example, and because of that, they need to make sure that they are educated enough about what to expect during the process itself and what's the longevity of the process. Whenever I sit and listen to the patient, and I try to see what is the outcome that they are looking forward to achieve. It could be some confidence, it could be some aesthetics. They want to avoid some daily hassle with the pain or dentures. What really motivates me is make them reach the outcome that they are looking forward to get. If you think about dentures, they are removable, so they cannot really keep them in their mouth. That will affect their confidence, number one. Secondly, the forces, their biting forces, is definitely way weaker. Hence, you won't really be able to enjoy your food the same way that you usually do. These are the main complications that people doesn't really like in dentures. So your implant will be better options because of multiple reasons. Starts with the fact that you will have more confidence with a fixed smile. They help in preserving your bone, and they will help actually in supporting your tissues to avoid showing any of these wrinkles that appears over time. So usually for implants, the ultimate is definitely to have zirconia because of its biocompatibility, which means how gentle it is on the tissues, how much the body can accept that new material. It's widely used in dentistry because of its high strength and durability. So whenever you are a prosthodontist and a periodontist, you are actually seeing the end results from the beginning. What it means, I can deal with biology by understanding the gums and the bone, which is definitely customized for each patient, and I can see at the same time the final outcome with the results. So it all comes to the planning originally. Every patient we consider them as an individual, and they have a special biology and special needs and special outcome that they are looking forward. So we make sure that we customize that smile in order to provide them with what they are looking for. Receiving the implant is not the end of the journey itself. Maintenance is important to make sure that these implants that you received are going to last you for decades to come. The way how I say it, if your implant succeeds in the very first 18 months, you will take your implants with you to the grave. Maintaining a good oral hygiene is a key factor, in addition to making sure that they comes for their regular maintenance. We always remember that beauty is very subjective. So we make sure that whenever we're going to deliver the teeth, it's more of a joint process where they have to have their own input. We always encourage them to bring their own photos. By bringing their own previous photos, we'll be able to mimic how they used to look. Here in Advanced Dentistry, we make sure that we listen to a patient. It's a patient-centered place, and we make sure that the patients are heard all the time, and we make sure that we don't really do any kind of shortcuts or cookie cutters for our patients, because we know everyone is individual and everyone has their special needs.